pulp. The general features include, it is nothing but it occupies the center of each tooth, as we all know, and the pulp chamber of crown is known as coronal pulp, and the root canal portion of the root, it is known as the pulp seen is known as radicular pulp. The total volume of all permanent teeth is 0.38 cc. Now coming to the anatomical or morphological features of pulp. So coming to coronal pulp, it occupies the center of crown of the teeth. The pulp horns, which are nothing but the protrusion of pulp into the cusp of tooth, is present, and the pulp chamber, it will decrease in size with age. Coming to radicular pulp, it is situated from the cervical region of the tooth towards the to the apex, and it can be straight or curved depending on the shape of the root canal. So this radicular pulp is in continuation with the periapical tissues through the apical foramen, which is nothing but the opening at the root apex. So blood vessels and nerves from the pulp will enter through this apical foramen. So the average size of the apical foramen in maxillary tooth is 0.4 mm, and mandibular it is 0.3 mm. So it is also wide in the younger teeth and become narrower with age because of the deposition of secondary dentin. So now coming to the accessory canals or lateral canals. They are the extra canals or extension of the main pulp through the root to the periodontal tissues. So it is seen most numerous in the apical third and can be seen near the furcation of the posterior tooth, such molars. So reason for formation is, one reason is because it is formed because of the premature loss of the root sheath, and second one is the developing root can encounter with the blood vessels. So the significance is that there can be a spread of infection from the pulp towards the periodontal tissue with this connection, that is known as pulpoperiodontal lesion. Next is the most common reason is the RCT failure or root canal treatment failures. So even if we clean and fill the main canal and extirpate the pulp, we could miss the lateral canals easily. So that will cause a failure in the root canal treatment. Now coming to the histology of the pulp, also we will discuss the zones of pulp in this histology zone. So the four distinct zones are odontoblastic zone, cell-free zone, cell-rich zone, and pulp core. So the pulp core is in the center of the pulp and it will move towards the dentin. So as we go upwards, this is just going from the center of the pulp towards the dentinal region. So the odontoblastic zone, cell-free zone, which is devoid of cells, cell-rich zone, which is composed of so many types of cells like a fibroblast, undifferentiated mesenchymal cells, and the last one will be the pulp core. Coming to the odontoblastic zone, which is seen near the periphery of the pulp or near to the dentin. So there they are composed of cell bodies of odontoblast. So this is a continuous row near the dentinal end of the pulp, and the network of nerve fibers from the pulp will be concentrated more on this odontoblastic and subodontoblastic area or zone. Now coming to the cell-free zone or zone of veil. So it is present beneath the odontoblastic zone and it is more prominent in the coronal pulp, that is pulp in the crown region. As the name says, it is devoid of cells or no cells. So in this zone there will be more ground substance and reticular fibers will be present. Now coming to a very important entity, plexus of Rashko, which is seen in the cell-free zone. It is nothing but subodontoblastic plexus. It is also known as subodontoblastic plexus. It is nothing but the network of nerve fibers which have lost their myelin sheath. So they are specific receptors for pain. Now coming to cell-rich zone. As the name suggests, it is abundantly rich in cells, so which is seen below the cell-free zone. It is composed of mainly, it has rich blood supply and more prominent in the coronal pulp. It is composed of fibroblast, undifferentiated mesenchymal cells, macrophages, immunocomputer cells, and collagen fibers. So it is also a reservoir for replacing destroyed odontoblast. Now coming to the last zone, which is the pulp core, which is in the center of the pulp. It is nothing but a loose connective tissue with abundant cellular elements. It is very rich in nerves and blood vessels. And as age increases, the fibrous component also increases.